Yeah, we're doing.
So I'm just giving a presentation about who we are. Uh, Today's session is being run by The Mentoring, a charity based in Cardiff, Wales. And we are a registered charity supporting individuals through mentoring and guiding people of all ages and backgrounds. So mentoring is all about listening, and what we mentor is we mentor people who are referred to us. Either it could be education, employment, health, or community cohesion. So when we get referrals, we ask them what their needs are. If it is employment, we try to put up a journey for them and their goals, and then we try to reach that within 6 months to 1 year. Everything goes for employment or health or education and community cohesion. So we got all these activities. So when any individual comes to us, we will give them these options of the mentoring activities that we do, and they choose what is meaningful to them. We don't force them, this is good for you or this is not good for you. So they choose whichever is meaningful to them, and they make friends. They have got lots of options for them. Either they want to choose friends and socialize, increase confidence. So in addition to these activities, we also have some workshops. We do one-to-one mentoring as well, bespoke mentoring. We do employment support, beauty sessions to gain confidence. Some people do not know how to take care of themselves, personal development, career professional development, interview skills, digital skills support, and several other workshops. We used to have this kind of mentoring on a one-to-one. When you see them, you can see how it has impacted. COVID had impacted this one-to-one mentoring because, one-to-one, nothing like face-to-face meeting. This is how it looks like, pandemic. You're going to be on a Zoom and then talk to people. I don't know how effective it is, but it has had an impact on our services. Some of the services that we do have been canceled because of COVID. Some we cannot do it because of social distancing, but we do visit people and try to give them as much support as possible. The referrals that we get, I don't want to go through in detail, but most of them feel very lonely. That's what they say. They've got everything. Sometimes they don't have it. But most of them, because of shielding, because of lockdown, they feel very lonely. These are the referrals that we got. And also most of them got unemployment, so redundancy that had given anxiety issues, and that led to financial. Domestic violence, we never received domestic violence. I've got nearly 10 of them who rang us and then talked about domestic violence. We are not specialists for domestic violence, but we signpost them to certain organizations. Housing, and parents of newborn also talk to us about how do we socialize, and bereavement. So these are the issues that our referrals had, and then we try to support them through mentoring services. We never forgotten about those who've got dementia. Those with dementia may find it very difficult to remember, especially on during lockdown, what to do, what not to do, and what's happening as well. So they wouldn't know that they have to wear face masks to go out, or they have to wash hands often, or they shouldn't be going out when there's lockdown. So our volunteers used to visit them. That just signposts, putting some signs in the kitchen to wash hands, and then near the door, front door, a sign to say that it's a lockdown, so don't go out, or wear face mask before you go. So these are the things we've done. And we recently did 3 events. One is Infodemic, wherein we brought in so many people from different backgrounds, from media, specialists, public health Wales, from different countries. It was a global event, and we had 4 speakers. That's what I said. We had Dr. Rao from California, and Mr. Sudarshan from India, and Sunil Pulapaka from Wales, and Natasha Taladi from London, who spoke about the infodemic, that is information and misinformation about this coronavirus. And it was a very successful event. The second one, which was last week, was International Women's Day, where we have recognized and learned a lot about women who have accomplished something and achieved. The last one last week was on sharing stories. That was a very good one wherein people shared their stories about, like today, 11th of March was the day when WHO declared it as a pandemic, COVID as pandemic. So we wanted to bring back on that day, particularly on 11th of March, to listen to people who could share their stories. So it was very, very interesting. We've got it on YouTube. I'll share that with you. So that's about us in short, but you can visit our website, www.mentoring.org.uk. If you would like to donate, you can donate through local giving. And we can follow us on Twitter. That is, Twitter handle is @the mentoring, Instagram, Facebook, and you can subscribe to YouTube channel called The Mentoring, wherein we're going to put this video. Thanks. So that is about us. I hope a little bit of this had given you an idea of what we do. Before we get started, I've already said that you have given us a consent for this event to be recorded. The event's recording will be shared across our social media channels, YouTube and Spotify, and on our website. Now, as already mentioned, WHO declared the outbreak a public health emergency of international concern in January 2020 and a pandemic on 11th of March 2020. And subsequently, UK went into lockdown on 23rd March 2020 when Britain's Prime Minister Boris Johnson told the country that people must stay at home and certain businesses must close. So we are here today, exactly almost a year, 23rd of March, what you have experienced, learned, and to think about what the future may look like a year on pandemic and the lockdown in the UK. So let me introduce all the doctors in an alphabetical order with last names. So we have Dr. Balaji Donepudi, GP from Colchester. Hello. Mr. Satish Janipireddi, orthopedic surgeon from North Middlesex Hospital. Dr. Venkat, Mandava, Anaesthetist in Coventry. Dr. Sushmitha pavuluri, GP with special interest in diabetes, Colchester.
Hello.
Dr. Ruford, sequeira, works in geriatric medicine, Aneurin Bevan Hospital, Gwent. Last but not the least, Dr. Sunil Pulapaka, child psychiatrist, who is a board member of the mentoring and the co-host and facilitator of today's event. Over to you, Sunil.
Good afternoon. Thank you very much for that lovely introduction, Sujata. Much appreciated. Right, okay. Thank you everyone for this afternoon, for taking time on a Saturday afternoon. Right, so the reason we wanted to host this is some of you personally would have endured COVID, right? Some of your family members have endured COVID. You have seen some of the patients whilst you are working has, well, left this world with COVID symptoms. So we thought, I'm unsure if you might have had time to share your experiences or had a time to vent your reflections, basically. We thought we'll create a platform today, being coming from the medical background with all our busy lives, to see if we can create some reflections from yourselves and share your experiences, and also the achievements which we can look at basically in you have achieved over the last 1 year. So and advice as to how we can move forward in future. So first of all, if I may request again in the alphabetical order, I believe Mr. Janipireddi, who has endured COVID himself, I think, correct me if I'm wrong, Mr. Janipireddi, it was early last year, isn't it, around April or May, I think, if I'm not wrong. I'll pass it on to you. I would love basically to know what exactly your personal experience was suffering with COVID, and do you mind sharing it with us, please?
Yeah, hi, thanks Sunil and Sujata for giving me the opportunity to share experiences. I think I know most of the panel members here, and I would say I might call it as that I was probably one of the first persons to be infected or affected with COVID. and I think it was in the first week of March last year. And I remember the dates very well. And I think we were just very closely following the news and how our hospital itself was being prepared, or how we were in the situation room. So just to recap as to what happened before that, was we were very much aware of the pandemic kind of going to hit UK. So I'm based in a busy DGH at London. And I would say one of the first cases which had both mother and daughter born with COVID was from North Middlesex Hospital. And then our medical director had come in to say that we should prepare for the worst and how we should be working. This is a typical, as many news channels have used, like a war situation, war room. So I think it was equivalent to that. So we all were sitting and discussing as how, from orthopedic point of view, we can help the hospital as a whole, and also the accident emergency as a whole. So that happened on March 5th. And if I'm not wrong, I think it was a Thursday. And the very next day, I had an incidental appointment at the Heart Hospital for a cardiac CT. It was nothing that I had as an emergency, but it was a planned procedure. I had the CT done on the March the 6th, and it was around 12:30 in the afternoon. I came back home, no issues. At around 2:30, I was called by the radiologist and also by the Public Health England chief to say that you have COVID. Do you know that? So I was completely taken by surprise, and I didn't believe what they were talking about. So I just wanted to clarify as to what was going on. So they said that, yes, your CT, which we did for the cardiac reasons, cardiac is fine, but we found that you have symptoms or signs in the CT which are similar to COVID, and this has been seen, and we have learned the same from China, because China used to do CTs at that stage. Coming back to March 6th, the timeline, I think once I heard the call and the news of COVID, I panicked. And I use the word panic, and I use the word also that I'm an orthopedic surgeon. And I think people will understand why I use orthopedic surgeon and then panic, because it is usually taught in the hospital that the surgeons are probably the completely opposite of fear. But anyway, I think that was not true in my case, and not true with COVID, definitely. So I was just going to look at the news at that time, and there were 51 people dead or announced dead in the BBC, and it was not locked down yet. The only symptoms I had, which later that evening my kids pointed out, that they could not feel any kind of sense of smell or taste, and they attributed it to my poor cooking. So so this was March 6th and 7th. So I was told that I was positive, or I was positive on CT. So I called the hospital microbiologist and the infectious disease consultants and said that, can I have a swab? At that time, this was still March 7th, the first week, we had no swabs available in the hospital. And the swabs were being done only for people who were admitted, who were very sick. So I was not included in that. There was huge pressure from the Public Health England. Public Health England called the medical director of our hospital to say that you should do a test for Satish. But I think the microbiologist, rightly so, looking back as to her leadership, that she rightly rejected even the Public Health England's advice and said Satish should isolate as anybody would, and he should call 111. So I did. 111 took around 45 minutes. But at the end of the day, what they said, take paracetamol. And I thought, I think they're doing the best what they could. And then I called a couple of my friends, and called my wife, who had gone on a holiday at that time. Basically, I was panicking. So the next 4 to 5 days, looking back, it was not much. But at that time, I think it was the fear complex. It was huge. It was very, very huge.
This is exactly why we are here. We are reflecting now. When you look back, you think there's nothing, but that time.
Absolutely, Sujata. As you said, I would say I was just curled up in bed, in my own cocoon in a small room in the box room of our house, and would not want to come out. And me taking paracetamol and Nurofen would not bring the fever down. So yeah, and I think within a couple of days, my wife had come back from our holiday, cutting her journey short or trip short, and yeah, and then we tried to use basic rehydration using all different kind of fluids, either it be juice or water, but the fever never came down. I had constant help from my colleagues and my friends and other extended member of family, but that experience took around 10 to 12 days. Yes, I think I can now say that year down the line, my wife was affected with COVID. So were both my kids, who were 13 and 11 at that stage. And my parents last month have been affected, who are in their late 70s. So we all have sailed through, but the experiences, I think all of us share the same, that we can be put down psychologically, and the fear complex is huge, not just because of COVID, but because COVID has been kind of shown under a magnifying lens, and in the news, you switch on the TV, you know that you're always kind of hearing of COVID. I think there are a few more experiences, but I think what I'll do is I'll pass on to Sunil to be able to kind of give the chance to the others as well. Yeah.
Thank you very much, Satish. Much appreciated, Mr. Janipireddi. It should be a traumatizing experience, isn't it? I mean, really, you're the first one. So I'm really sorry. I thought it was April and May, but you are one of the medical personnel who, even without lockdown has started, you have endured it, right? That must be really traumatizing, because none of us knew even a single thing about it, isn't it? But I'm really impressed actually how much you have fought along. And surprising thing again, as you mentioned, your missus, kids, and even your parents who have endured that as well. So you have gained a significant amount of experience, isn't it, in the last 1 year, dealing with its symptoms per se and also working with it. Thank you very much, Satish, for sharing your experience, personal experience. Right. So
we'll come back to you. We'll come back to you, Satish, later on. Don't go away.
Thank you, Sujata. Right. So can I just request Dr. Mandava, who also had a personal experience in enduring COVID. If I'm not wrong, Dr. Mandava, you were one of those anesthetists who have been dealing with, well, unfortunately, few casualties were there, isn't it, whilst you were treating one of the anesthetists, one of your colleagues in Coventry Hospital. Do you mind sharing your personal experience, you enduring, and could you throw some more light on that, please? Thank you.
I mean, being an anesthetist and seeing COVID patients during the pandemic, the initial period of the pandemic, where we didn't know much about what is happening. We're throwing everything at the patients and trying to treat them. And at the same time, seeing colleagues being affected by the COVID and coming to us was a bit traumatizing, and it's like treating your own in the hospital and trying to do best for them at that point. Unfortunately, for me at that point, I did have an exposure to COVID, and I did have an infection for about, I think, about a couple of weeks. And I think I got through it the way, I mean, I did everything for me the way I used to tell the patients to do it for them in the wards, or they come to us. And that's the way I got through it. And even one of my uncles who got the COVID, I guided him to go through all the things that he needs to, like hydration and basic things that he needs to do, like paracetamol and all that, and the supportive management to help him get over it. I think that helped me and my uncle to get over it, and all the patients that I treated. One thing that I also told them is, like, if you get COVID, don't panic, because pressing the panic button will start upsetting your system, and your body will start to react in a different way, and you will be seeing the COVID symptoms getting worse. If you are calm under these stressful circumstances, there is a good chance you can come out of it. And that's what I did for myself, and that helped me a lot.
Yeah. Thank you very much, Dr. Mandava. Much appreciated. Just correct me if I'm wrong. I believe you endured it around May, June. Is that right? Or is it a bit later?
April.
Sorry?
It was
April. Right. Thank you. Thank you very much. Right. Okay. So, I mean, I'm pretty sure, I think as far as I am aware, only Mr. Janipireddi and Dr. Mandava were the ones who endured COVID personally, unless Dr. Pavuluri or Dr. Donepudi or Dr. Sequeira want to share their personal experiences if you have endured. I'm sorry, I don't know about that. But if not, I would appreciate if either of you can also share experiences of your family members or any of you people who have experienced this, and what was your experience like? I'll start with Dr. Sequeira, if that's okay.
Oh, it is about the family. Thank you. Yes. Well, it is slightly difficult. It was slightly difficult. The period, in fact, as Sujata mentioned in the beginning, March 23rd last year, it was a very, very special day. Not the March 23rd, but the March 22nd, because it is actually my son's birthday. And I was actually planning it in a big way. I had booked some fast racing car experience for him. And yes, building up to this, the COVID, the lockdowns were planned in the beginning. Everything about this was so much notional and stochastic, and we did not know anything. Just within a few blinks, the whole world has changed. I did ring the supercar company on a Saturday. Are we going ahead on Sunday? I was a bit too ambitious, but yes, by then, unofficially, the country was in lockdown. Sunday was the 22nd March, and then Monday, the 23rd, officially, it became, went into the lockdown state.
I remember it as 22nd, but sort of officially we have to remember it as 22nd.
That's right. Yes. From an audacious life, we all went into a kind of a life in a cell from that day onwards. The hospitals, when I went there on the morning, the car park was empty, completely empty. You could play cricket or football there. The roads, I actually went to drop my son in the morning as a part of the key worker children. The roads were deserted. There was a policeman, probably, I think, he was trying to find out whether any people are moving from one area to the other. But I don't know. People were panicking. When I went to the hospital, it was all empty as well. The staff were, quite a significant number of staff were absent. From a kind of unpretentious confederate of the team, I just became a very important piece with a very few pawns on a chessboard. Why I'm bringing chess is my son plays chess as well. So yeah, there were no consultants, literally. Everybody was ill, everybody was off. The divisional director came to me, can you handle 4 wards with other people, the juniors from other departments who had no idea about how to manage geriatric patients. So it was difficult, leaving early in the morning to drop my son, who normally goes by bus. So I had to adjust my timing as well. I could not say no to the hospital people because I know there was shortage there. Well, we managed. My health was also, as probably Sunil, Dr. Pulapaka knows, I have a underlying health condition and I was struggling myself. But after a certain time, yes, everything was coming together. We knew more and more about COVID. Children started adapting to their routine online, so-called online classes at that time, which was just nothing but play because everything was suspended. And my wife, we all come from the South Asian background, India, and I was telling her as well, there was very little evidence coming about certain things, vitamin D, take vitamin D, take vitamin E, all those things, even though at that time the evidence base was very limited. But yes, I was pushing as well. So she started taking all those things. And yes, we survived the first part of the COVID without much hustle. But in the end, I think it was in December. I don't know whether it was too cold. I did go out well covered as well. But one day when I came back, my toes were very much discolored, as if they were of first degree frostbite. I was a bit worried because by then, I had started a new treatment as well. So whether it is a side effect of the medication or whether something else, I was trying to find out from my other friends. One of my cardiology friend in North Wales, he said, Ruford, I think you got to have a test done. I said, why? I don't have any symptoms. No, there is an entity called COVID toes. Well, again, as Dr. Janipireddi said, it was panic mode at that time, but somehow I did manage to look on the literature, and it is there mentioned as the COVID toes can be a part of the COVID pathology, which was just recently published at that time. And yeah, luckily I had my swab test done, which was negative, but I was convinced that, it was nothing other than the COVID, as my son, exactly about 2 weeks later, developed exactly the same symptoms. And that too, the same toes, the second toe on both limbs. So it can't be just an isolated a frostbite. It had to be. But luckily, yes, we survived without any major complications or any side effects. But there we are now. So that was just a brief, experience altogether. What I had gone through from the beginning of March, managing almost whole hospital, the community hospital, in fact, 4 wards on my own, with hardly any staff, and then like any other medical doctor here in this country, managing the family part of that as well, dropping the boy in the morning and then trying to collect him before the school closes at 4 o'clock.
Dr.
It was a
Sequeira,
struggle.
you said you got underlying health condition, and how did you feel? Because we heard so much on TV and media that underlying health condition, and coming from BAME communities, you have to be very careful. And how did you manage to go to the hospital and drop your child as well to the school? So you were exposed yourself. So how did you feel about it?
Yes, it was, I knew from the beginning that, if I don't look after myself, there is nobody else to look after me other than my family. So I was actually in the beginning fighting with the management, fighting with the rest of the team there, that I need proper PPE. Yes, they agreed to begin with. I was using the proper FFP3 mask on the ward as well. And then said, if you want me to manage the whole hospital, yes, you need to look after me, then I'll look after you. So that was the condition between me and the managers. And they were quite good. Managers did support me. They did provide me the adequate PPE. Yes, only thing is, even if you have an underlying condition, yeah, just look after yourself, follow the precautions, come home straight into the wash, and all the uniform. And I was using the scrubs. Everything went into the washing machine along with my wife's uniform. So yeah, we followed quite a strict protocol at that time.
Thank you.
Thank you very much, Dr. Sequeira. I totally echo your feelings actually and experiences with our young people being taken to school. Right. Thank you very much for that. Right. I'll move to Dr. Donepudi. If I may request you in regards to your personal experiences, I know it's a complete change of your environment as well, isn't it, in terms of working? So probably you started online working and stuff like that. How much was your exposure in terms of COVID, basically, personally, or rather as a family? Do you mind sharing your experiences, please?
Thank you, Sunil. I think, like most people, work had changed completely. So it's newer modalities of working, whether it's online, telephone, video, consultations. Yeah, we still had to assess some patients face to face. So that had an impact, certainly not just for the clinicians, but also for the administrative staff in the surgery. So we had to be mindful of that. Other patients, actually, you had to be mindful of other patients who are present in the surgery at the time also, especially if they are clinically extremely vulnerable or the shielding group. So if we had those people as well, so we had to segregate that. And yeah, initially it was very difficult getting used to all those, and you had to balance the risks of bringing the patients in versus the what if I miss something, or it's always that fine line. When do you decide, do I take the risk of bringing the patient in, or do I see how it goes?
How about your staff, Dr. Donepudi, in your surgery? How did they react to your patients coming to the surgery or online?
I think, thankfully, it's now, I think, like you said, Sujatha, right at the beginning, it's all a distant memory now. But I think I have a memory that's really good in a way. Well, when I say I have all the sweet memories, in that everybody played their part, staff agreeing, willing to work, go that extra mile and do their bit. We don't have offices for admin staff, certainly, where you can socially distance for extended periods of time. They're not exactly cramped, but they are not suited for pandemic working. We had to make do with making sure that infection control procedures are followed all the time, but everybody took the risks carefully and also played their part in a team working.
Thank you.
We had to take the difficult decisions of isolating the extremely vulnerable pregnant staff members. All those risk assessment, workplace-based risk assessments have been done. I think whoever was allowed to do the things were playing their part. In fact, actually going the extra mile in helping both the patients and us clinicians. Otherwise, it wouldn't have been possible at all.
Was there any psychological fear or effect amongst your patients because of COVID?
I think it is almost an understatement if we said there was nothing. I think definitely everybody had fears. I think even patients, actually, we've seen that in the summer and early autumn when there was the lockdown was lifted. Actually, you started seeing more pathology. People had been putting up with all that pathology they were trying to wait or defer until the lockdown was lifted. So you were seeing advanced pathologies, and you would have never seen those.
Because GPs are considered as the first point of contact for any kind of issues. So maybe you had inundated phone calls asking what's going to happen. Even if they don't visit you personally, you must have had tough time. So that's why I'm asking if there's any calls, anxiety phone calls.
Absolutely. There's always there's always that element, but I think the initial period, the very beginning, I'm talking about March, April, perhaps even early May, I think the workload has significantly reduced in terms of the number of patient contacts, but actually it is getting used to the new guidelines coming in, new protocols coming in every minute almost, one from PHE, one from local infection control, one from Royal Colleges. So I think the plethora of guidance that was coming out, I think it was difficult to cope with that initially. And thankfully, the patient demand at that time was slightly lower comparatively.
Thank you very much, Dr. Donepudi. Much appreciated. Okay, now I'm going to move to Dr. Pavuluri. I know you must have had similar experiences being a GP, but also when in the infant stages of early last year, basically, when we don't even know much about the pandemic, and you are a specialist in your diabetology, basically. So do you mind sharing what exactly your experiences were in regards to COVID personally, or probably you have seen patients coming to your cells or ringing you?
Sure.
Thank you.
Sure. Thank you, Sunil and Sujata. I think I was just trying to memorize the events starting with the pandemic. This is something that we have never experienced, and hopefully the experience for a lifetime. So it was pretty scary, like all of you said, when this all came out, and we had to make lots of changes to the workplace, and there is a lot of overlap between the personal experience as well as the work experience as GP. So I was just remembering kind of the changes we had to make at the workplace, create cold sites and hot sites, separate and deploy all the staff to make the environment safe. And I remember I commute to work, it's about half an hour commute. So kids used to ask me, "Mummy, lots of parents are working from home, why do you have to go to work, leaving us at home?" When they were doing homeschooling. So I used to remember, I used to kind of feel pretty scared and a lot of fear, uncertainty. What am I going to, if I get COVID, that's okay, I'll endure it, but I might pass it on to kids, I might pass it on to my husband, or all kinds of thoughts will go through your mind. I remember this very interesting conversation I had with my brother-in-law. We used to phone family, and kind of as doctors in the family, you tell them, you try to answer their questions and doubts. So he asked, you guys can't work from home, you must be going to work every day and seeing the patients, whether they have COVID or not. And then he said, well, actually, it's your chance to do something, to be soldiers on the battleground, front line. And this is your chance to make a difference to people, save lives, and help and support the patients. Actually, that was really, really kind of, it stuck in my mind. And I used to feel, oh, yes, I actually felt that fear and despair turned into strength and pride in a way. So, yeah, I think it was really helpful. I really felt proud to be part of NHS and to help patients in need. In a way, kind of, we have adapted, we found how resilient we are, and it's kind of the whole lot of humbling experience. The patient experiences, when you hear them losing the loved ones, the bereavement, the how scared they are, the social isolation, it's really heart touching, and we were able to kind of help them, support them. And I remember we used to kind of use this or wear this PP, personal protective equipment, just looking like we're wearing space suits and just going into the hot site, seeing the patients diagnosed with COVID. That's pretty frightening, but we got used to it in the end, and we were treating the patients, and they're so grateful. Whether it is the care home patients, very understanding. If we triage them over telephone and just tell them you can call us back if things get worse, you feel short of breath, whether it is physical illness or if you feel anxious, panicky, just call us back. We will talk to you, and leave the worry to us. In a way that used to make such a difference to patients, because lots of patients, they are totally scared, frightened, anxious, and not knowing what to do, lots of uncertainties, unanswered questions. So I think it's been a hell of a lot of experience, but actually in the end, just felt I found peace with life and a different perspective. Also now, I always feel very proud of NHS with all its challenges, with all its flaws, but it's a kind of a dream come true for any healthcare system coming from a country like India, or even if I kind of talk to friends or family members in more advanced countries like USA, but I think we have a healthcare system where we don't need to look at whether we can afford a treatment, whether it is the life kind of changing illness, whether it is organ transplant, whether it is cancer diagnosis. Everybody gets the treatment, whether it is the expensive drug or lifelong immunosuppressants they need to be on. I think it is part of a really great organization, and also going through the pandemic, I think we can make a change, dispelling the myths that people have about vaccination, and getting out that message about whether it is the vaccines or kind of the disease, illness. I think we have a opportunity to do a lot being part of NHS, and I think reflecting on it, it's a great place to be.
Yeah, Dr. Pavuluri, you said you've got special interest with diabetics.
That's right. Yeah.
Is there any specific thing that you can reflect on the patients with diabetes? How did they cope with this COVID and lockdown?
Yes, patients with diabetes are made a clinical priority because there is increased mortality and morbidity with diabetes. They are at increased risk of catching COVID, and also complications or increased risk of death with COVID. So we had to kind of prioritize and change the way we work. So we couldn't kind of concentrate on controlling the diabetes as intensively as we would have done otherwise, because we had to change the type of work we were doing, giving priority to COVID. But I think we still have a very good in-house diabetic team who identified the patients who are more vulnerable, more in the kind of elderly, patients with poorly controlled diabetes. We were able to still kind of treat them and help them and support them with their illness, and also advising them to keep safe, follow the guidelines, shield if they are in the shielding group. So it's reinforcing the message, because when it comes from their own doctor, they tend to listen better, and they have faith and trust in you. So that's where you can make a difference. Important.
I know they trust GPs, and that's a primary contact, for them to talk to you. So thank you. Thank you.
Thank you very much, Dr. Pavuluri. Much appreciated. I totally admire your work. Basically, you have to juggle the family life on one side, as well as traveling half an hour away, coming back again, looking at the family. I'm really impressed. Thank you very much.
Thank you. Pleasure.
Could you take the spotlights away, Sujata, please? Let's go back to the normal sort of screen. So, if I may request, well, all the esteemed doctors in your own fields, actually, you have shared a lot of personal experiences, what you endured and what you have done. If I may request, basically, 1 year on to reflect as to how these experiences, personal, work-related, family-related, and where we stand at the moment. So this is an open discussion. I'm happy for anybody to unmute yourself and speak, please. Yes, Dr. Sequeira?
Well, we are still in a land of uncertainty, because even though the pandemic seems to be fairly under control, coming under control in the UK, it is spreading its tentacles quite wide open elsewhere. The main European subcontinent is struggling badly, and as you know, the Indian subcontinent, the cases are rising. We do not know what is there in store for us in the coming months. Yes, we have done a lot of vaccination drive here in the UK, and as well as some of the other wealthier countries. But the lessons that we have learned so far is, I think, looking after yourself, looking after the people around you, your colleagues, and following the guidance meticulously. There is no room for any juggle there. You can't relax those guidance even for one single day, because it's uncertain. You never know what is coming your way. In terms of the service provision, yes, it has changed a lot. As two of our esteemed GPs have mentioned, that everything is now either a telephonic or a video conferencing call with the GP, with their patients. Still, quite a significant number do come physically as well. But yeah, for us in the secondary care, we are still dealing with the telephonic clinics. But, seeing patients directly face-to-face on the ward, thankfully, we can do that because, at least in my hospital, which was one of the worst hit in the first wave back in March and April, the cases have almost gone nil. So yes, for the time being, we are managing the inpatients quite fairly well, but outpatients, just because we need a bit more playing ground there, so we would probably go a bit slower until the scene is a bit more safer and clearer.
Okay. So what do you think, Mr. Janipireddi? What would you reflect on the last 1 year on?
I think it was not easy for anybody. And I think in the news and everywhere, if you see, the health workers or caregivers have been given the importance or have been kept in focus. But I think everybody played their part. And having had COVID very early and being able to get back to service, as Sushmitha said, how could you help? Now it's your turn. So I think we tried to get back. But I think, in fact, everybody have done their part. And I think we should say that we can't compare Boris Johnson and Trump alike. And I think Boris Johnson has actually risen to be a very great leader, in my opinion, along with the other policymakers. So I think they have steered the country as a whole very finely. And I think NHS has definitely helped. And it's learned from the first wave, as Ruford said. And I think things have not greatly changed in terms of how we have managed the second wave, because the deaths in the second wave have been more. But I think at least we knew that it was coming. So I think so the war room or the situation room was better planned, and the policymakers or the leaders in the hospitals and the organization gave responsibilities equally to different people. So I think it was a little bit easier, and we were not in that panicky mode when we were hit by the second wave. I like to see as to how I have given back and how I have helped as orthopedics in London. What they had done is there was a good kind of association between the hospital, the councils, the colleges, the Royal Colleges, and also the bigger tertiary hospitals in the area. So they streamlined services. They took away some services from us, and they had done all the trauma cases at Royal National Orthopaedic Hospital. So it was good, but we were instead asked to help medics. So we would instead ask to help somebody like Ruford. We would instead ask somebody to help maybe like Dr. Donepudi to kind of help to see as to the GP were not able to see and the patients had poured to the hospital, how we could filter or how we could triage and help them. So different experiences from an orthopedic point of view, not definitely orthopedics, but more into medicine. So I have learned end of life care and learned or trained into the communication skills and trying to break the bad news. And we were also asked if you could just come to the wards and help the medical doctors to just do the scribing, or go down to the mortuary and just write the medical certificates or the death certificates, or just call the family member and just tell them what's happening. Or sometimes we were told, can you call them and tell them that not to come to the hospital, your loved one is dead. So we've learned as a consultant, I would say I've learned more from the junior doctors because they have helped a lot. The nurses, hats off to them. They have done a wonderful job. And I think there is a lot to learn from the juniors and from our medical colleagues. And as far as orthopedics, I think I can stop there because my reflection goes more to how I have been asked to do things rather than how I have been. So the second part of the pandemic, I think I've been led rather than leading.
I echo with you, Janipireddi, because we are from the social third sector, voluntary sector. We have learned a lot how to cope with this, how to talk to them, how to break news about their, whoever is in the hospital, especially. They don't know what's happening. They couldn't even say goodbye in the normal way that they should be, when they have lost their loved ones. So it was very emotional for us to deal with such kind of people, and they don't have families sometimes. So over to you, Sunil. I wanted to ask you one thing, if that may be relevant. I wanted to ask all of you, how has this social circle you have had impacted you, your social life? Anybody can take over. I think Sushmitha would love to.
Okay.
Well, sorry, Sushmitha, go on and I'll give you a chance. Go on.
Sorry. It has totally, I guess, it has changed completely. We used to used to have a very social life. Almost every weekend we used to have people come over or go and visit them. Of course, Sunil and Satish, we used to meet quite often as well. So we had to change and adapt to, we had to be happy with the phone conversations. So we try and keep in touch, speak to one another, and try and make sure they're all right, and what's happening with them and their families. So so that's a total change, and I probably wouldn't have even imagined something like this could happen, where actually we have to not meet anyone for a year, or for let alone for a few months. I was actually talking to Balaji the other day. I can't believe that we've done this. In the olden days, imagine if there were no phones or no WhatsApp or no social media. It would have been unimaginable that you can't see each other, you can't communicate, you don't know what's happening with others. I wonder how they coped with the pandemics before all this mobiles and gadgets. But and the kids ask, oh God, can we not go out? Can we invite somebody? Can we go somewhere? Oh, it's boring, mommy. What fun things can we do? And yes, we come up with some games, or we go out walking, and then next week, oh, the same old thing. It's boring. Can we do something else? So it's trying to find.
One thing I must mention, Dr. Pavuluri, I mean, it has definitely stimulated our gray matter, isn't it? We had more innovative things. We learned a lot of new things in the last 1 year. Trying to keep our kids engaged, isn't it? That was the most important thing. Everything in the small box. If you're like in a small box, you need to come up with new ideas. That itself was a skillful. Being coming from the medical background, we forgot about everything else. Yes, family matters a lot. So that was an amazing thing, isn't it? Sorry, Dr. Sequeira, before I just moved to Dr. Mandava. Yeah, you wanted to share something. Thank you.
It is quite funny about the social life, and I don't want to go, into. I completely reflect what the other doctor has mentioned, but something different happened with me in terms of the workplace. My personality never changed. I just carried on working, and the personality doesn't change anyway. So what the COVID provided me was some extra time on the ward. As you know, in the initial days, the wards were slightly empty, I would say, some of the wards. So the interaction with the ward staff from, ward sister to the domestic, that has changed a lot. They got to know me more, and especially the domestics. Oh goodness me! One of them would make a cup of tea every day with a little snack, and she would keep that on my desk, on my office desk, even if I'm not there, even if I'm around the ward doing ward rounds. By the time I come back, there is a cup of tea with a snack. So that shows that, yes, even in that confined space, where there was a limited social interaction, just by saying one or two extra words to, the people around you, your colleagues, you actually widen your social base. And, that helped me, to cope as well. That helped me. I was feeling so, gratified by that somebody is actually taking effort to make a cup of tea for me and give a snack. So yeah, I was quite taken aback by that, and then I felt that I was truly appreciated.
Thank you. Right, moving to Dr. Mandava. I mean, we didn't touch on, basically, I believe you might have moved on to COVID rota. Just reflect on that briefly with your personal family changes, as well as Dr. Pavuluri initially mentioned about what kind of things has changed apparently, and can you reflect a bit more on that, please?
Talking about COVID rota, I think being an anesthetist, and we did see patients in a pretty bad condition, and day in and day out, going and seeing the patients and not improving was a bit. It did affect us quite badly in terms of mentally, but working in that environment, because everyone in the first phase, it was quite daunting because we didn't know what was coming up, but in the second part, and the second surge, we did. Everyone came together, and it was like we all worked together, and I think it did help everyone to mentally and emotionally to get over the difficulties that we faced at the workplace. And it's not the working pattern, but it's the seeing the patients go through that was very difficult. But I think all of us being together, I think it did help us to get over it. And at home, when coming back home, I think spending a lot of time with the kids and family, because we did have quite an off time as well, because with a different rota, we did have off time. We had to spend a lot of time with the kids, and saying so, we couldn't go out and do things that we normally used to do in the past. But now, the most the innovative ways that we found doing things together was like trying to play games that we used to play as kids, and teaching the kids the new games that we used to do as a kids, and teaching them to play them, because they never knew those games existed. And they enjoyed. They did knew what our childhood used to be like, and I think so. Coming to the socializing thing that Dr. Pavuluri was mentioning, I think it did help us to though we didn't meet people, we did do through Zoom calls, and we did have quite fun time with family and friends. We didn't meet in like a year, but it did help with that new, with our, what do you say, the new gadgets that we have now, everything that has helped. It's like normal for the kids No, but for us, kids going back to learn what we did as a kids was an amazing experience for them. And I think that did help.
Thank you. I echo you, Dr. Mandava, totally, because you're right. I mean, Chinese checkers, Ludo, chess, caroms, these were nostalgic. They brought me a lot of memories, basically. Me playing with my own son, and they brought my cookery skills as well. A lot out what exactly I could do with my son. Right. Thank you very much for reflecting, everyone. I wonder, I mean, if I could start again on alphabetical order with Dr. Donepudi first. What do you think your achievements were in the last 1 year, just 1 year on, since the beginning of last year, if I may ask? At least one, if you can, please.
It's you can't specify one. I think there's loads. Whilst it's been busy, manic year, but still it's been sedate in a way. That you could say, yeah, from a professional front, you've achieved a lot in terms of we've been able to work in an integrated neighborhood team, including the social services, the voluntary sector, and the third. So all of us working in a cohesive way has come a long way, certainly. I think we are able to understand each other's pinch points and help out each other in a way, in the end, keeping, whether you want to call the client or the patient, the heart of this. I think each of us helping them, I think, has come a long way, certainly. So using the digital technologies, say, for example, the meeting like this would have been almost very difficult to organize, except for accepting the technology that has probably always existed, but now has been more adopted. I think we're all getting used to these. We're not putting up barriers, but we're all ingenious in the ways that we want to make it happen. I think we've all accepted that. So that's another thing. And the mere fact of sitting here and being able to reflect, I think, says a lot to me, that we are actually at an intellectual level. We are thinking about what's happened, what's going to happen. Personally, I think there's a silver lining to all this for me. Spending time with the family, I think it's going from that fast-paced life of constantly trying to do this, that, and the other all the time, now slightly relaxed, having a different perspective. Somebody was saying early on, life affirming. I think I think it's been a brilliant journey all along. But I think it goes without saying that my thoughts go out to those 126 or how many ever 1,000 patients and their loved ones who are not here anymore in the UK.
Yeah, it's interesting, as you said, we have made friends with strangers and who helped each other. They didn't know each other, but they have really helped each other, and not necessarily face-to-face, online, talking to them and giving suggestions and advice. So it was an amazing journey for all of us for a year, especially coming from the third sector, voluntary sector. We had to ask volunteers from any background to go and help anyone. So we have really helped over 150 international students, mostly from Hyderabad or Andhra Pradesh or Telangana. They had, all of a sudden the universities had closed. So we had to help, and we have formed a WhatsApp group and started helping them emotionally, as well as they didn't know what to do because they didn't even have laptops to go online because they just came in January and this happened in March. And so we had to work with England team, Indian High Commission in London. So it was a different experience. I never did it. Not many students used to come to us. Very few students used to approach us for any help. But I now still get some calls asking for some help. It is domestic violence. Somebody wanted to take life. There's a lot of things we never heard of. And it's very sad that these things are happening now. And it's not fair. It's not right for students and young people to suffer like this due to pandemic. But we're all here. And I'm glad I met you all here and sharing this experiences of yours.
I mean, sorry, go on, Dr. Donepudi. Yeah, you're saying something.
Just saying thank you and hats off to all the good work. I think, yeah.
Yeah, I mean, considering the time, if I ask Mr. Janipireddi to just give me a couple of achievements over the last 1 year you have experienced or achieved, would appreciate that, please.
I'll probably repeat what Dr. Donepudi and Sujatha have mentioned. I think we have, or I have learned that, or probably we can say that we have taken a lot of positives from this negative COVID. I think COVID has taught us many things. Not to be mechanical, not to run in the same direction, kind of, but I think it has given us time to reflect. And as Dr. Mandava has said also, that it's given us time to see that we need to spend more time with our family. I think there are more people who need help than us. I think we are better off. I think in this panel, one would agree that we all are in the working age. And I think we have been fortunate to be able to keep in pace with the technology and keeping our mental health well. But I think there are extremes of age, as you would agree, Sunil, both in pediatric child area and also the other end when Dr. Sushmitha was mentioning the mental health has been affected. But from my point of view, I would say that I've learned a lot. I learned a lot new skills, including communication, breaking bad news, and trying to see how we can help a completely different department, which is not your daily routine. But I think we've had help from NHS, colleges, medical councils, and everybody, and even the patients or the people have been wonderful. They've been very patient. They have appreciated the profession, and I think it's hats off to the leadership of the NHS and the country as a whole.
Thank you. Could you give your couple of achievements, Dr. Mandava, please?
Achievements. I think it's the team work always pays off. Everyone, if they do everything what needs to be done, I think that pays off well in terms of like looking after the patient and yourself. And I think that's what, I mean, being from an anesthetic background, we work in a team-based, I mean, it's a teamwork-based environment. And I think that helped to look after everyone around you. And so that I could propagate that to to other people, saying that if you work in a tandem, then that will help. I think that does help.
Thank you. Could I move to Dr. Pavuluri, please? Could you give us your 2 important achievements in the last 1 year?
I'm just trying to think hard about that, but I think it has, again, like others have said, it has highlighted the importance of teamwork, importance of every person in the team that you're working in. For example, in the GP practice, every staff member contributed towards patient care, giving the best they can, and also in their absences, how we still cope with the isolation and still deliver the patient care. And also in the community, you're part of the community. We have neighbors who are very elderly, and we just used to send them a message during the lockdown. If you're isolating, we can get some provisions for you from the supermarket. How grateful they are just for offering such help. And they kind of go on and tell every person, the workmen, they come, oh, we have neighbors, Dr. Donepudi and Dr. Pavuluri, they're so nice, they're so kind. They offer help. Just the little things matter. And I think it made me feel more human after this experience with pandemic, and made me realize we are humans. We need to offer help and support to each other, and that goes a long way. So yeah, I think that's my take on this.
Thank you. Can I move on to Dr. Sequeira? Could you kindly give me your couple of achievements, please?
Right. I could not agree more with the previous panel members. Absolutely, it is true that it has made us realize that there is life beyond our routine life. Well, everybody has given a lot of explanation about that. But on a personal front, my achievement I can be proud of is that standing tall on my own in the first wave, when everybody else was falling apart, and holding the fort for the department and for the patients. I think that itself, having an underlying condition as well, I felt that it was a good achievement. I did not even take a single day off during the first wave until July, end of July, where I was actually forced to go on annual leave. You just go, you need a break. That is why I was able to take that. That was one of my major achievement, I can say that. And then on the other personal front, yes, I have learned, like Dr. Pulapaka mentioned as well, some culinary skills. Yes, I'm a better cook now.
Thank you. Thank you very much.
Some more recipes from Dr. Sequeira.
Why not?
That we can, yeah. No. Right. Thank you very much, everyone. I personally want to share my personal achievements as well, if that's okay for you all. On a personal level, you're right. My culinary skills, definitely my board game skills, which I used to play when I was little, that has definitely improved. On an academic scale, I don't know, probably some of you might be aware about Dr. Raj Gopal. He always used to talk about microbiology. In my whole life, I never read so much about virus in the last 1 year. So I've learned a lot of things about virus, which definitely made me help a lot of people. I bet you all might have had calls from abroad, India or any other part of the world, asking, right, I had this COVID symptoms. Am I having COVID symptoms or not? So I had to reflect on so many articles in the last 1 year I read. You won't believe it. You name the article journal and I Lancet, BMJ, even in the BJ Psych, that's a psychiatry journal, every journal I've been reading about. And you know how camera shy I am. So this kind of webinars conducting has definitely helped me being more positive and upfront. So these are my achievements I can talk about, really. Right, so I'll leave for my CEO now to give final comments, or if anybody else has any other things to add, would really appreciate, being considering the time, sorry.
Anybody else would like to say something before we wind up?
No, just backing Dr. Pulapaka's last comment there about improving the personal knowledge. Yes, I have attended numerous online webinars, seminars, you call them. I think this time my CPD credit is so high that I'll have to pick and choose. Otherwise, I think another Royal College will be after me.
It's true. Mm-hmm.
Oh, thank you all who opened up to talk about sensitive and personal stories as well as work, and some are positive, and you came out with big achievements and also learned new skills during this pandemic. It's a learning curve for all of us, and we learn a lot. It's not going to end, but it's going to be like this, I think, this year as well. So we will meet again and see what is in store for us this year. Thank you all.
Thank you.
Okay.
Thank you.
Thank you, everyone. Thank you very much for your time. Okay.